Hello, everyone. This is my discussion post for this week. We were looking at existential and Gestalt theories and some of the things that how they are different. Gestalt theory, one I see that could be used, both of these actually could be used for trauma work for various different reasons. Um, the existential therapy, because it's philosophical in nature, you can get back to the meaning of life and sin from a Christian perspective, specifically in a Christian counseling setting. You may be able to do that in some other settings with different religions, but you have to be very careful to how you tread with that because you don't want to have implicit bias when you're coming to talk to clients. So, Gestalt therapy, um, actually, I'm sorry, existential therapy basically is being more philosophical in nature. So you talk, like I said, talk about the meaning of morality and the meaning of life. You ask more philosophical, deep questions to really root out different things in the therapeutic relationship. Whereas Gestalt therapy, you are looking at more technique-oriented approaches. Um, Basically there was a list of different exercises you could do with your client. You can do empty chair exercises. You can do just different things along those lines to bring about the therapeutic um, method of treatment that you would want to do. So I think some of the limitations that we run into here would be that clients for a existential therapy approach, they it'd be very I think it would be a more select group of people that would actually be able to work with something like that because they people generally want a more clear-cut approach and not a philosophical one. So I think that might be a empirical problem with the existential therapy. It could be very good, but I think you need to have someone with the right background for that. With the Gestalt therapies, I think that would be a better approach with a lot of people, especially people who have been abused. Um, Specifically, because I think they're, from my own perspective, is just wanting to have a clear cut way to be able to deal with trauma and deal with different things in your life that's going on. Um, so I think going into that, and the third question is that I think they're kind of incompatible. You either have to go one way or another with that because um, there are two different approaches. One is very existential, one is very talking about the deep meaning and philosophical stuff, and the other one is really using a specific modality of treatment to be able to help your client attain a specific goal more so than the existential therapy. Obviously, both theories are trying to come about healing the client, but I think they're doing it in a different way. So that's where I think that they're incompatible together. You kind of have to choose one way or another. So the final question, the limitations for creating, I think, measurable outcomes. Um, it would be hard for existential therapy to have um, measurable outcomes because there really isn't a lot of standardization and being able to study different techniques. It's very kind of out there. Whereas, so it would be very hard to get an exact science of, okay, let's try to get you to from point A to point B. It's not necessarily going to be a straight line. It may never be in therapy at all, but I think with the existential therapy, it could kind of fluctuate a lot. And the one more thing to look at that I thought was very interesting that I'm going to add with the Gestalt therapy is that um, they said that you would need to be careful about early termination from clients because you could elicit a response from them, and also it can be put into the wrong hands, could be very abusive using powerful techniques to elicit these responses. So if you're not properly trained in how these techniques are going to elicit these responses from your clients, it can be very damaging. So that was interesting to see. So definitely using an approach like that, you need to use with caution and make sure that you understand. exactly what you're doing and how you're doing with that. So, but I think going on that same question, I know I'm a little bit over here, but going with that, I think that having that base of those techniques to be able to really dig deep and dive into the emotional hurt and pain of these clients, I think that you would be able to have also, I don't know if you heard that, but got a message on my Mac. I'm not sure if it's loud enough, but where you heard it, but I apologize. Um, with those specific um, treatments or techniques, I should say, I think you can have a more measurable outcome with your client as opposed to the existential therapy. So, anyways, thank you so much for watching, and I look forward to hearing your responses. Have a great week.